welcome everybody who is in the room. This is our fourth in the Fireside chat series, Midlife Women at Work. Today, we're going to be talking about employee benefits to 65 and beyond, and around that, becoming a more age-friendly workplace. I'm coming to you today from Vancouver, BC in Canada, and we are located on the traditional and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh people. I'm super excited to have Valerie Travis join me today. And while we just wait for some more folks to join the room, I'm going to let Valerie go ahead and introduce herself. So welcome, Valerie.
Thanks so much, Kate. Thank you. And welcome, everyone. Good morning, good afternoon, good evening, good middle of the night, wherever you might be. As Kate mentioned, I'm Valerie Travis. I'm the founder and lead benefits consultant at Bespoke Benefit Solutions. My background's in psychology, but my entire career has been focused on helping employers build meaningful and sustainable benefit programs. So that's my passion. I've been doing this for over 25 years now. I can't believe it's been 25. It's been a lot of fun working with Canadian employers, building benefit strategies that align with who they are, who they aspire to be in supporting employee well-being. In the past, I've been part of small, medium, and large benefits consulting teams. And for several years, I actually sat in the employer chair. I managed the benefit programs across Canada for Maple Leaf Foods. And I think, as someone mentioned to me recently, I hadn't thought of myself this way, but I guess I am part of the great resignation. Because last year I left my role as VP of Health Solutions at Aon Consulting to launch my own firm. And at Bespoke Benefit Solutions, what we do is we look to partner with employers, like many of you who have joined today, and benefits advisors, to create benefit strategies and designs, employee surveys, benefits education, communication, plan audits, manage benefits projects. Just a few examples. I've had the pleasure of writing some articles on benefits management and speaking at several conferences. And coincidentally, most recently, I spoke on the topic of benefits past 65. So a fantastic lead into today's conversation. I think you can tell I'm excited to be joining you today, Kate, because it brings together so many topics I'm passionate about, areas I know you're passionate about, and top of mind for so many employers today. So thank you so much for inviting me to join you today.
Oh, I'm just so excited to talk with you and to go through this subject together. So I am Kate Milne. I'm a healthy aging specialist. I'm a community-based health promotion researcher. And I also have about a decade, or had a decade, of experience in voc rehab and disability management. So I bring that lens to the conversation. These days, I really spend the bulk of my time helping organizations to support, retain, and recruit midlife and older female staff by becoming more age-friendly organizations. And when I say female, of course, I mean everyone who identifies as female. I also have had a number of years of helping both government, cities, and organizations plan for an aging population. So I think that's another important piece. So I'm going to give a little bit of background, and then we will go through the questions, if that's okay. Does that sound okay, Valerie?
Fantastic.
Great. So I just want to set the stage for you, as we do with every fireside chat. We know that our workforce is shrinking, at least here in Canada, and the population is aging. Just to put this in some context, in one of our last long-form census years, in 2016, we've had one since, but I think this census year was important because in 2016, we had about 36% of our workforce were folks over the age of 55, And that was the highest number on record since StatsCan had been collecting records. And by 2026, that number is projected to increase to 40% of our working age population. And again, to give you a little bit of perspective around that, back in 1996, we had about 3 workers aged 27 to 34 for every worker that we had who was 55 and older. And now we're at a 1-to-1 ratio. So pretty significant in our workforce, this aging population. And within that aging population, one of the fastest growing groups is women over the age of 55. One of the other projections is by 2026 that women will constitute 1/3 of those newly hired. So that is where some of our attention is right now in terms of that workforce, and of course an interest to me working with in healthy aging and with older adults. So another piece around that, when we think about that aging population, is the changes in our workforce. So we've had this kind of slow and steady decline in labor market participation. As of February of this year in Canada, our annual labor market participation rate was just over 65%, 65.4%. And at the same time, I think everybody's aware we've had this kind of great resignation, great reshuffling, great reimagining. It's been called a number of different things. But what's significant in the last year is the demographics of the people who are in that great resignation. And that's really shifted to folks, the bulk of the people in the great resignation between the ages of 40 to 60, and also people who are in knowledge-based industries like finance and tech. So it's just had a bit of a demographic shift. And of course, related to this particular fireside chat, women have been leaving in unprecedented numbers for all sorts of reasons. A recent survey by Deloitte that was done in 10 different countries around the world, which included Canada, women reported that they intended to leave. About 50% of women reported, and I should say in all age groups, but about 50% of women reported that they intend to leave their employer in the next 2 years. And only 10% of the women surveyed plan to stay with the same employer for the next 5 years. And I'm sure people have seen this in the media. It's been a big topic in the last few weeks that C-suite women are leaving and women in leadership are leaving in the highest numbers, and they have some of the highest intent to leave. And so another survey that was recently done by Qualtrics, this was a bit bigger, 14,000 employees in 27 different countries, found that the intent to stay in those female leaders had dropped by 21 points. So the phrase that's being used most often is that the female leaders are the first out the door, sadly. So a number of different things going on: an aging population, this shrinking workforce, the great resignation, and then a loss of women in the workplace. So that was all a mouthful. I'm going to give you one more, a few more details. I want to be clear about the term age-friendly, because you hear this being used in all sorts of different contexts. But age-friendly was really a movement that was started by the World Health Organization about 15 years ago. And the original intent of the age-friendly movement was to help people stay in their communities longer, to age well, to be active in their aging. And the World Health Organization intended for this to happen all over the world in different communities. And they quickly realized that this was a very limited view of helping people to what was then called age successfully. We don't use that term so much anymore, but they went back, they talked to groups of people all over the world about what helped them in terms of aging, and came up with these 8 different dimensions. And this has been a very robust movement worldwide, particularly here in Canada, around planning for aging. But it's been applied to the workplace in a way that's sometimes been a little bit clumsy. The original dimensions were really designed for community planning. And so, we can't easily talk about outdoor spaces when we're talking about the workplace. That would be one of the dimensions. So researchers have gone back and really tried to look at what are the important pieces in the workplace that make it age friendly. Now, to be clear, when I say age friendly, the focus is on older adults and people as they age, but the philosophy of the age-friendly movement is that if you create better structures for people as they age, that this helps everyone else as well, or that's how we should be planning. So we should be thinking about age-friendly as a continuum. So one of the best papers, I think, around the age-friendly philosophy in a workplace looked at both organizational culture. So looking at, I think we all sort of probably understand that term, given who's on our call, but this idea of culture and vision and values in an organization, but then also looking at the climate. So how are the HR practices working for employees? What are some of the policies? So thinking about those two big umbrella terms, and these researchers led by Epler Hatab and colleagues, this paper was done in 2020, came up with these new dimensions for the workplace. And I just want to run through them really quickly. I don't want to take up all our time, but I really feel that we need this context because this word is used so often. So thinking about an age-friendly workplace, if we thought about these 7 different themes or dimensions, we'd start out thinking about flexibility. I think this is important again for all age groups. Of course, we've really learned this during the work from home situation during the pandemic. There's a lot of different demands that people have in terms of things that are going on because of the pandemic. So thinking about a more flexible work arrangement for folks. The second is around training and learning. So making sure that there are appropriate development opportunities for everyone. Looking at job design and redesign. Can we make workplace adjustments to help folks stay in their roles longer or to reimagine roles as they get older? Of course, recognition and inclusion, having a more positive environment for workers as they get older. There are a very limited number of DEI programs that include aging as part of their mandate, and we'll talk a little bit more about that as we go along. The other, of course, is around equality and fairness. This ties in, but thinking about recruitment practice and internal mobility. This is one that comes up quite often with women as they get older. And again, we'll talk a little bit more about that. Health and well-being, my area, very important in terms of keeping folks well, getting upstream in those health promotion initiatives. And then the last piece is around retirement or redeployment. So can we bring in some of those flexible arrangements to make that work for everyone? So that's where my background information ends. I'm going to start by just talking about one of the first questions, and I'm going to turn it over to Valerie to answer most of this question. The question is around what is the opportunity that you see for retaining workers in midlife and beyond and even past retirement? And so I'd throw in just a very quick 2 cents before I turn this over, just to give a plug for this idea of cognitive diversity. We know that when we have more diverse groups, more diverse teams, and of course, thinking about this from a mixed age perspective, in the research, we know that when we have mixed age, we have better relative productivity overall, and we can see that there is better performance related to more complex decision-making tasks. So, Valerie, I'm going to turn it over to you, and maybe you can talk about some of those opportunities or benefits.
Well, that is the question, of course, is how do we plug this into the workplace so that it can be that opportunity? And I'm going to think back to a survey that I know Aon did, I want to say it was 2016, where they polled Canadian employers specifically and asked them, what did they see as the advantages of having employees stay in the workplace? In fact, the question was phrased around having employees stay in the workplace even past 65. So as we start to think about how we've trended towards retiring before 65, and the question was, how do we keep people in the workplace even up to 65? This question was focused on, what would you see as the advantages of having people stay in the workplace even beyond the normal retirement age? And employers at that time, remember this is all pre-pandemic, pre our new world, called out the need for the experience, knowledge, skills that these older workers could bring, that they could be essentially built-in trainers and mentors for the less experienced employees, and that they'd be a key part of succession planning. And again, I'll put that in context that employers were answering this survey in 2016, and now fast forward to today when we're in the midst of a challenging environment to attract and retain employees. You can think how these factors that employers brought forward at that time would be even more essential today as the opportunities for a workplace when they do decide to focus on retaining and attracting older workers within their teams. We see it's very easy to see this all over LinkedIn, that teams are stretched thin. There are plenty of recruiting notices out there looking for members to join the teams. Even within our HR teams, this is a new wave we're seeing. Our HR teams are becoming tired. They are leaving. So our teams are very stretched thin, challenged to fill positions. So keeping older workers engaged and embedded in an organization means it seems rational. We're going to avoid turnover costs, and we're going to keep that continuity of the care for the customers, the clients, the products that we're bringing to society. But if that's not enough, I'll mention a survey that shared a statistic I found quite striking recently. So Randstad showed that new hire costs are 21% of a position's current salary. And when I said 21%, nearly a quarter of a position salary that you've got to now account for if you're going to be having to deal with an individual leaving your firm and having to replace them. So if we can find ways to engage older workers, to keep them in our workplace, and in this time when we have stretched teams, we can have a built-in training department ready to go to mentor those next generation. I love that you called out the DEI piece, because I couldn't agree with you more. I think that organizations we're welcoming the change, that we're seeing organizations more focused on DEI, but age diversity hasn't been as much of the conversation as it clearly could be going forward. Completely agree with you there.
Mm-hmm. What about some of the challenges, Valerie? What do you think around that question?
You know, it's interesting. In that Aon survey, I got to give them credit, they asked that question as well. They asked, what were the advantages of having older workers in the workplace, but what would your concerns be? And this being an anonymous questionnaire, you knew you could get some answers that people might not say in if they felt that it was socially unacceptable to speak this plainly. But some of the concerns they brought forward were productivity and performance. Would older workers be able to keep pace with younger staff? Would we have to encounter health and safety issues? Are we going to have more illnesses and absences? Are we going to have higher employee benefit costs if we keep these older workers on the team, as opposed to letting them transition and we start to look for younger workers to come into the teams? And you can kind of see where some of this perception would come in. If it's, imagine a fast-paced organization, perhaps it's a highly driven sales team, and there's these preconceived notions that younger workers are going to be more ambitious, more driven. But I find that an interesting perspective when we mirror it against a perspective we've dealt with in the workplace for many years around younger workers, that there was a bias against bringing younger workers in because, well, they're going to start families and we're going to lose them, we're going to lose their productivity. So it's an interesting dichotomy we're seeing there. And I think that an essential piece of this puzzle that I know we're going to talk about today is employee benefits. So many organizations have not yet grappled with that question of when should employee benefits end? Should they end or reduce at 65? Many organizations are continuing to do that. And this is a challenge in keeping talent, because you can imagine now what you're doing is you're effectively paying someone less because they've reached a certain age milestone than someone who's doing the same job with the same experience. So employers are going to have a harder time keeping employees from moving to competitors if they're offering benefits and you're not. So I think that's the challenge we've got to face in here.
Mm-hmm, mm-hmm. And I think I would just add on in terms of some of those biases against older workers. It's really interesting. There are so many different surveys and research articles around bias and ageism in the workplace. And the numbers sort of range from, pardon me, from 60% to 90%. The World Health Organization talks about 1 in 2 people in the world having some sort of ageist attitude. And of course, that's across the board. That's not just for older adults. But I think the other piece around that perception around older workers in the workplace is in hiring practices. And some of the numbers that I've read from surveys are upwards of 40% of hiring managers who have admitted to throwing out resumes because of when people graduated, or what the years in terms of their experience. And then having colleagues, so those hiring managers talking about having colleagues who are openly biased against applicants over a certain age. And again, they talk about those same things that you talked about. I mean, lack of experience with technology, or, not being able to keep up. That idea that folks might be retiring soon, and then also maybe a bit of resistance to change. And I have to say, as part of this conversation, of course, because this is the Midlife Women at Work series, gendered ageism is an incredibly pervasive problem, and one that women talk about often. Pardon me, there is more ageism reported by women in terms of being called back for interviews, and they're more likely to suffer job losses. We saw this during the pandemic. And then there's a whole other intersectional overlay on that. So women in the BIPOC community, women in the LGBTQ plus community, and folks who have a disability. All of those overlays make a difference in terms of that ageism as well. So I think that's just important to acknowledge. The next question, Valerie, is just around, and I think it leads in from some of these perceptions, is the myths around older employees. Could you talk about that a little bit in terms of some of the myths that you've come across?
I love that question. And I think, the first one that comes right to mind is that if we keep older workers on our teams, that they're going to cost more. And this is a challenge I hear from many employers that I work with. And on the surface, it can seem logical. I mean, if we think about the fact that our older workers likely are being paid higher salaries, and there is the potential for bringing in newer talent that may come at a lower cost, I think that's where an employer needs to really pull that conception apart and say, but why are we paying higher salaries for these individuals? It's because they're bringing the experience, the talent, the skills that they've built over the years. Okay, then let's leverage that. Let's make sure that we're getting all the value we can from those individuals, and some of the ways we've talked about already, for example, having newer workers essentially stand on the shoulders of those who have gone before. Within the benefits space specifically, it's a clear concern from employers that if we continue benefits for older ages, and we're talking specifically in Canada past 65, because most of the legislation will prevent age discrimination under 65. But employers who are concerned, if we continue benefits past 65 for those who continue to work, isn't this going to become very expensive and we're not going to be able to afford our benefit programs? And admittedly, when we look at things like life insurance and disability insurance, it's logical. Yes, benefit premiums increase as we age. But then we think about provinces like Ontario, where once you reach 65, you can be turning to the province's drug plan to cover many of your prescription costs. So now a health plan could actually become less expensive for an employer to provide coverage to an employee who's past that age 65 milestone in a province where provincial coverage kicks in. We also need to remember that older employees, likely their children have already grown and moved on. You're likely covering a much smaller family unit. So that can actually be less expensive than providing benefits for a younger worker when we're thinking in health and dental benefits. And going back to something we talked about a few moments ago around absence and productivity and time lost due to sickness or illness, I think that's clearly a common concern employers have, is that are we going to see that our disability costs are going to go up if we keep people on our staff longer? And there's a really interesting set of statistics that's come out that shows that, as we know, mental health claims, mental health incidents within disability plans is continuing to rise. That's nothing new. We know that. What's surprising is that when we look at the demographics, we see the age group where those mental health disability claims are increasing the fastest is in the younger generations, and more specifically in the younger women. So if we're layering on this lens of, aren't disability and sick leave costs going to increase if we have older workers on our team, we could actually challenge it the other way and say, aren't your disability costs going to go up if you have younger workers on your team, because they're the ones who are experiencing a higher incidence and duration of mental health related disability claims? And I think, as I pondered that survey, I was thinking about many of the factors that might go into it. And one of them, I think it ties into the experience conversation we're having, that if I think about early in my career, maybe the same for you as well, Kate, if we think about some of the things we encountered early on and how we would have dealt with it at that time, because we hadn't yet built up the resiliency and the coping skills. And then we go through a few more life experiences. We deal with a couple more difficult clients, a difficult performance review. And now when those things come up again, we've got a little thicker skin. We don't take it quite the same way, and we start solutioning as opposed to being impacted personally and having it to have more of a personal impression on us. So I've seen this in many times in tech companies, for example, where they're hiring large groups of young staff to come on board, and they're putting them in very demanding positions. In many cases, these staff haven't yet had those multiple career opportunities. So this is the first time they're put into a role where they're expected to be juggling multiple priorities in a high stress environment. And sometimes they're burning out, and they're the ones who are going on disability leave. So I think there's another aspect to that myth of, do older workers cost more? They can actually be the ones who can stick it through when things get tough. They've got that resiliency, those coping skills that they've built. And if we make sure that we're structuring our environments to support them, they could actually cost us not more, maybe even less in some cases.
Mm-hmm. Yeah, it's a great point. And I think just thinking about the health piece as well, when I think about, from my perspective, around those myths, one of the things that I hear quite often is people thinking that, retirement is the route to better health. And there's some really interesting research around this. It's mixed, of course. I need to put that caveat in that there are some papers that would suggest that people have better health, but there are a number of papers that indicate that risks of chronic disease go up pretty substantially, especially in folks who take early retirement, which is really interesting. Now, of course, we need to tease apart, are people taking early retirement because their health is not great to begin with? It's really a place for further research, but there's an interesting piece in there for me, thinking about one of the biggest risks to folks in the community as they get older is social isolation. This is one of the hardest things on our health, believe it or not, in terms of our health outcomes for a number of different chronic conditions as we get older, is when we are socially isolated. That has this really big impact. And there is a connection between, that full retirement in some people and social isolation. So that's a myth that I suppose I would try to dispel as well, that it's not necessarily 100% better for our health just to have this hard stop with work at a particular age. So all really interesting. Can you talk a little bit more, I guess, a bit more detail around the threat and the opportunity as well for employers around ending those benefits at that hard stop of 65?
It's I, I have to say, I find it kind of amazing that this is even still a conversation, that this is still on the table. I'll put a parallel though. So if I was to say, we're only going to cover benefits for employees up to 45, and if that was permitted by law, all of a sudden jaws would drop and we'd say, but wait, like what? You can't end benefits at 45? That's not right. What about all the people who are working past 45? And so I'll challenge the thinking there to say, so what's the difference between 45 and 65 if you can access those benefit programs from an insurer? And it's interesting that despite the opportunities that we're talking about today, so much experience and skills that older workers can be bringing to our populations, we do continue to see Canadian employers ending benefits or reducing benefits at 65. And the first question I find often comes to mind is, but wait a minute, didn't we end mandatory retirement in Canada across most of the scenarios? It's not possible for me to require an employee to retire at 65. So is what I'm doing even legal? Can I actually be ending benefits at 65 and providing different, essentially, compensation to younger versus older workers? And the surprising answer is yes, but I'm going to put a big asterisk beside it and a big caveat. Because yes, what we've seen is that when mandatory retirement was eliminated throughout Canada, most of the provinces structured the human rights code such that essentially age discrimination does not apply to employees past 65 with regards to benefits. So you effectively can, let's say, discriminate against someone who turns 65 within your benefit plan. You can offer them different benefits. And now that's what's embedded into many of our human rights codes across Canada. But the question still remains as to, well, why would our governments do that? If we went through the steps of eliminating mandatory retirement, why would we allow employers to end benefits at 65? And it was really based on a common belief, at least in large part, that benefits would be significantly more expensive, the plans would be unsustainable if employers were forced to continue benefits past 65. And so what we've seen over the years is that a number of legal cases and grievances and arbitrations challenge this. But I'd love to share with our team today that's joined us that there's a particular case, and those who are benefits nerds like myself, we refer to it as the Talos case. There was a teacher in Ontario who decided to work past 65. And when he turned 65, his benefits ended as per his collective agreement. But the challenge he faced was his wife was quite ill. He wasn't able to secure benefits on his own that were affordable and comprehensive enough. And as a side note, I'll just call out here that I think a misconception is that if we don't offer benefits, employees will be able to go get them on their own. Many times, what we call conversion products, the paths that employees, retirees can follow to get their own benefit plans, they're quite limited, they're quite expensive, have many medical limitations to them. In this case, Mr. Tellis found that he couldn't get coverage that was going to be enough to take care of his ill wife's expenses. And he filed a human rights complaint. He said, this isn't right. I'm continuing to work, I'm an employee, but my benefits have ended, I'm being treated differently. And when it went in front of the Ontario Human Rights Tribunal, they looked at a very interesting key piece of evidence. They looked at actuarial evidence to say, okay, we've always believed that benefits would be way more expensive if employees were covered past 65. Is this the case? And when they looked at the actuarial data, they found that it didn't support that common belief, at least in Ontario, and in particular where we have a provincial drug plan that kicks in. At the end of the day, the tribunal looked at this case and said, we're siding for the employee. We do not believe that the employer would experience undue hardship if they need to continue these benefits. We also see that the Ontario Human Rights Code is essentially in conflict with our Canadian Charter of Rights and Freedoms. But then what happened was particularly interesting, kind of set the stage for where we are today, in that nothing changed. So the Human Rights Code didn't change. The tribunal said, you guys figure it out for yourselves. We'll give you the opportunity to strike a settlement if you can reach one. They did, and the Talos case kind of faded into the background. So we hung our hat on this idea that perhaps this is going to change everything, and it didn't. So I'll circle back to what I mentioned earlier. You know, is it legal? Can we end benefits at 65 in Canada? And the asterisk I'll put there is yes, most of the human rights codes would support that. However, that's not going to protect you necessarily from legal challenges or grievances, and it may not always be the case. So that's the threat employers should think about, is either you make a decision deliberately about your benefits today, or perhaps someone makes it for you down the road. I love, though, that you started the question off, Kate, by asking also about opportunities. And I think I'll circle back there to the opportunity to stand apart, that to get ahead of your competitors here as you're looking for how to keep the talent you have and attract new talent, is looking at your benefit plan as an opportunity to stand apart and offer benefits beyond 65. And in some cases right up to retirement, because surveys continue to show that benefits are an essential reason why employees stay or leave an organization.
Yeah, and it's interesting. It just fits right into the next question that was posed by one of the attendees. And I'm going to read it out because it's fairly specific. Prior to my retirement, I had many discussions and presented on this topic. I did not observe much uptake by plan sponsors. Have you noticed any material action being taken by sponsors in response to these issues?
Wow. So I'm going to assume, based on our topic, this is an individual who has left a workplace, who found that benefits were ending at 65, and perhaps has also encountered the challenge that Mr. Talos faced, where going out and trying to secure their own coverage at an affordable cost that was going to mirror what they had through their employer plan was just not available to them out on the marketplace. And I would love to say that things have changed in recent years, but unfortunately we just are not seeing that change happening. And I think that speaks in part to how we do things in Canada. So if I think about what happened immediately after the Talos decision came down, as a benefits consultant, my phone was ringing off the hook. Clients were calling in. They wanted to talk immediately about, okay, wait a minute, my benefit plan ends benefits at 65. Do I need to be worried about this? Should I be changing things? What are the opportunities? What are the risks? And we had some great conversations start. And then they saw that nothing really changed in the legislation, that we could still kind of hide in the shadows a little while. And then the next priorities crept up that grabbed our attention. And of course, remember the TELUS decision came out in 2018. What were we all facing in 2020? Our attention was pulled away. So at this point in time, we don't see that really much has changed. But I'm curious to see if now is the era when things are going to finally start to change, because we have new context, new environment that we haven't dealt with before. Retirement, I would say, is less accessible to many employees. Gone are the days when so many organizations were providing what we would call a defined benefit pension plan, where you knew that when you retired, the employer was on the hook for providing you a certain amount of money every month as your retirement plan. And so many organizations over the years have moved to what we call a defined contribution. Essentially, they're putting money aside for you, and that money will be whatever it's going to be based on investments that are made over the years. Here we are in this tough economic climate. We've got market volatility, we've got inflation, we have perhaps children who aren't able to afford homes, and they're looking to their parents to navigate that, figure out if they're going to be able to help or move back home. We are also in this environment we keep talking about, which is this challenges to attract and retain talent. So all of this is creating a new microcosm that employers are needing to operate within. So I'm optimistic. So perhaps through conversations like we're having today, perhaps we'll see employers starting to see the opportunity and the advantages of having older workers on board and looking at it as this opportunity as opposed to a premium cost, as well as embedding benefits within that lens of DEI and how they can stand apart as an employer of choice. So I'm optimistic, but the sad truth is that not much has changed since this individual left the workforce.
Mm-hmm. Mm-hmm. And yeah, it's really interesting in terms of, this change afoot right now following the pandemic. There's also this very large aging population in Canada. And I think that at some point we will have to take notice of that. That planning is going on behind the scenes in many communities, but sometimes not as much in organizations. So that leads me into the next question that I get asked actually all the time is, where do we start to become a more age-friendly organization? You've given us some great information around benefits. Maybe I can just talk very briefly about some of the things that we can think about in terms of becoming more age-friendly. And one of the places that I would start is having an age-friendly audit. So looking at the whole package. So looking at that organizational culture and climate that I mentioned at the beginning of our talk, making sure that we're really looking at all our practices and policies around aging in the workplace and how things are benefiting folks of all ages. Of course, I would absolutely agree with your point about DEI, that adding age to your DEI policies and including that anti-bias training around age is extremely important. This is something that continues to be reported in very high numbers in the workplace. Ageism and gendered ageism, I think we need to address that. And then along those lines, looking at your recruitment practices, and seeing how age factors in terms of recruitment. Of course, training and learning, as we talked about earlier, that was one of those themes of the age-friendly workplace. And there are opportunities to do things like reverse age mentoring. Valerie, you talked about, having those mentors in the workplace. We also have an opportunity to use younger folks to mentor older people in the workplace. An example would be around newer technology. If there's a worry about older adults not being able to pick up the technology as quickly, this is an opportunity to create that reverse mentoring opportunity. Of course, we go back to creating flexible work arrangements and part-time postings. When I do surveys and focus groups with older adults, this is one thing I am told most often, especially from people who have already retired. A lot of them say, I would love to be working, but I don't want to be working full time, or I don't want to be working all year. It would be great if I could find a contract or a part-time position that would work well in the lifestyle that I have right now. So that's just something to consider. I also would say it's really important for us to recognize this potential mismatch between chronological age and self-identified age. And we see this all the time. I get asked all the time, what is midlife? What is an older adult? What is a senior? And it's really hard to define those things. And it's funny that we use chronological age to define them. We're putting folks who are incredibly fit and involved and engaged in their workplace, and they can also go and get a senior's discount. And I think for some people that's a mismatch in terms of just their own perception. We don't tend to do this with other groups in this really hard way, and that I mentioned earlier, that hard stop at 65 or 55 for early retirement. So what we typically do in the work that I do is we focus on function rather than age, because this is not a homogenous group. Saying somebody is 65 or 75 doesn't really tell me a lot. But if I can understand how they're functioning at that age, that makes a big difference. And then finally, I would say just really thinking about involving all age groups in decision making and committees and things like that. I think that's really important to have that age diversity at work, and that adds to that cognitive diversity as well. I would also give a little plug to that upstream health promotion that we talked about again at the beginning of this session. The reality is chronic disease. We've seen, COVID and infectious disease for the last few years, but what has really been our biggest killer worldwide, and especially of women worldwide, is cardiovascular disease. We know that cardiovascular disease kills more women than all cancers combined. And this is across the board, and especially true in Canada as well. Our rates of cancer, unfortunately, are quite high, but the good part of that story is it's because our population is living longer. So those chronic diseases are something that we need to get in front of. And you might ask, well, why is an employer responsible for that? And I would just encourage employers to think about chronic disease prevention, because there's a cost associated. There's a cost around absenteeism, there's a disability cost, and, again, in terms of productivity and all of those things, we have changes in health. I don't think we can deny that as folks get older, but it's not inevitable. What we call that is the usual part of aging, but it's not the inevitable part of aging. We can work to prevent chronic disease. So we do that through targeted well-being programs, making sure that we're focusing on well-being programs that are appropriate for all age groups. So one example would be around bone health. One of the issues that women develop, especially around the menopausal transition, not only does their risk of chronic illness go up substantially, but their bone health changes. So we need to make sure that, we have appropriate exercise programs that recognize that fracture risk in women. And then also, I mentioned menopause. The UK is usually way ahead of Canada, at least in terms of their planning for an aging population. And one of the things that's happening in the UK is there's been a parliamentary committee looking at menopause in the workplace and making sure that we're not discriminating with women going through the menopausal transition around that gendered ageism piece. But also in the UK, and there's a start in Canada to provide menopause support programs. And again, there is a significant cost associated for employers in terms of those absenteeism costs, disability costs, and believe it or not, around menopause. It's not a medical condition, but it's a condition that all employees with a uterus will go through. So it's one that's important to recognize, and one that's, shrouded in a lot of secrecy, unfortunately, still. So that's something to consider. I think also making sure that we're including well-being in the value proposition in terms of recruitment, thinking about, things like sustainable workload, family and caregiver friendly. Again, caregiver costs have been outlined in a number of different research areas, and I can include some of those in our recording. I'll make sure that we include all of our papers that we're talking about today. And again, in that value proposition, flexible work hours, commitment to mental health, those sorts of things. And Valerie, I'm sure you could talk a little bit more about the disability costs associated with not getting upstream in that health promotion piece.
Well, exactly. And you think about the statistics that show the incidence of chronic illness, how it increases between as you reach age 65 plus versus those who are in the 50 to 64 range. And we're thinking of things that are common household words now: arthritis, diabetes, CPOD, high blood pressure. So as employers are thinking about going back to the cost question with regards to continuing benefits past 65, if we can get upstream, if we can be focusing, as you mentioned, wellness initiatives around these areas, and wellness initiatives that have enough depth to them, that we're going to be addressing concerns and interests and medical conditions that we're seeing across our workforce, we're going to be able to mitigate many of those chronic illnesses early, identify them, address them, and to be able to manage them so that hopefully we don't see the continued escalation of costs for the older employees. And I'll add, I loved that you did raise that around wellness initiatives being targeted at different groups. And I'll say also thinking of age-inclusive programs and ways of bringing those initiatives to the workforce. A lot of times we fall back on activities and team building events that may be very engaging for a certain segment of our workforce, and we may be missing out on the opportunity to talk to our older employees who are looking at this going, that's not really for me. So that's a great opportunity to kind of hit two goals with one stone, is to find ways to make sure that our well-being messaging is getting to all of our employees, but also treat it as an opportunity to bring in more team building and to intersect the generations within our workplace.
Absolutely.
From a disability perspective specifically, I'll encourage employers to challenge the disability providers that they're working with, to challenge them to be creative, to not just look at adjudicating, should this person be off work or should they be at work? Is the claim approved? Is it declined? But actually looking at the work environment itself, looking at the capabilities that our older employees have and where they may need a little bit extra help in order to maintain the level of productivity that they want to bring to the workplace. And that's where you've got to really dig in. You got to have a partnership with your disability provider and challenge them to be thinking outside the box of ways that we can accommodate some of the specific needs that may come up. I love that we're talking about hybrid workplaces, that we're talking about potentially 4-day work weeks. Perhaps this flexibility, as you called out earlier, flexibility in the workplace is going to help to make it easier, not just for employees to want to stay and to perform the work, but also to be able to do self-care so that we don't see this roll into higher disability costs. So I think the conversation often starts at disability is going to be too expensive if we extend it. I think it needs to go in the direction of, okay, how can we think about this differently? How can we look at this as an opportunity to better support all of the generations that we have in our workforce now?
Mm-hmm. And I think that's a great place for us to just take a pause. We're right close to the end of the hour. And so what I'm going to do is I'm going to put up a slide where folks can just connect if they'd like to talk to Valerie or myself. If you have any questions, if you want to discuss any of these topics in greater detail, we just have some booking codes on that slide and you can get in touch. And maybe Valerie, while I'm doing that, you can check the chat and see if we have any other questions.
You know what, I may have to ask Graham's help with that because my chat is not showing up here. But while we're while we're doing that, maybe I can share a question that I was emailed recently, which was around, it had to do with the affordability question again. And as they thought, the question was, how do I build the case to bring this up to leadership, that this can be an affordable option to continue benefits for our older workers? And, you know, the answer that I would love to share is, if I can speak plainly, what's the reality? Is it cheaper to provide benefits and to create an inclusive workplace that's going to be engaging and help you with your attraction and retention? Is it cheaper to do that than the cost of not continuing benefits? The potential draw on your pension plan, if we see the exodus of individuals who are leaving and going to, in DB scenarios, taking their pension funds, the cost of retiree benefits, legal challenges, grievances, talent loss. So I'll challenge you to think about, as you're presenting that case to leadership, what is the cost if we don't continue benefits past 65? And then look for those ways to mitigate costs, like integrating with the provincial drug plans, not necessarily covering, adding a number of new benefits to the plan, but maybe adding flexibility, as we've been talking about today, through something like a healthcare spending account, so employees can tailor the benefits to what they need. So I think there's clearly some opportunities to make this an affordable option of part of the value proposition.
Mm-hmm. Mm-hmm. Just checking to make sure that slide is up. You can see that on your end?
There we go. I can.
Great.
Thank you so much for raising that, Kate. And you'll note that on my side, the QR code will take you to my webpage, and I'd invite you that when you get there, there's an additional info field. Just fill in there that you joined us for the Fireside chat today. I would love to talk with you on any of the topics we talked about today, and any of the ways that we may be able to help your organization in making it more inclusive for all generations.
Absolutely. Yeah. And so I think we'll probably end there. And I just wanted to let everybody on the call know that I will be sending out a recording of our session. I'll be sending that out to you by email probably in the next 24 hours. And I hope that you'll join us for any of the upcoming Fireside chats. We're going to take a break over August, but we'll be back in September with some more topics around midlife and older women at work. So thanks so much for joining me today, Valerie.
Thank you so much, Kate. This has been an absolute pleasure. Thank you to everyone who joined, and look forward to continuing the conversation.
Wonderful.